I have lived 1,000 lives.
Are you feeling okay?
I am every one of them, and they are me. I have been the future she fought for, and the future they dreamed about. I have restarted hearts and resuscitated hope. I have been newfound strength. I have been John's second first step, and I have been the present in someone's past. I am midnight and the morning light. I have moulded amputees into athletes. I am the pupil, the teacher, the leader. Don't just live your life, live 1,000 lives. We are the NHS. We are recruiting now. Search NHS Careers.
Hi, my name is Deborah Olusanya, and I'm a healthcare assistant with the NHS. I would definitely say that the pandemic was a big factor to me wanting to pursue a career with the NHS, because during the time I was at home due to online school, because I'm currently a sixth form student, and this was last year when I was in year 12. So I decided that I wanted somewhere to help. I wanted to help as however I could. So that's when I went on to NHS Careers and I found the role to become a volunteer. As a healthcare assistant, I do similar roles to what I did as a volunteer. So doing tea rounds, so giving people their coffees, their teas to the patients, and then making their beds, laying their beds once they go to the shower. And if they're incapable of going to the shower, giving them a wash and just doing their observations as a healthcare assistant and helping them to go to the toilet, transferring them. And now as a healthcare assistant, I'm able to be more hands-on because I've acquired the training that was needed of me. Things I couldn't do as a volunteer because I didn't have the training. So, but yeah, the healthcare assistant role has the roles of a volunteer, but it's just a bit more in depth, like more detailed roles. My advice would definitely be to speak to someone if you know anyone who is within the NHS, to talk to them about the role, see how it is, whether you feel like that role suits you. But to definitely try and find some experience in a hospital, whether as a volunteer in a hospital, a medical center, a GP, a vaccination center, because I feel like doing that will give you a good first-hand insight on how it is to have a role or a job within the NHS. And whether it's just 4 hours a week, which is what I did as a volunteer, that 4 hours let me see everything a doctor would do, a nurse would do, a physiotherapist, a physician associate, many roles within the NHS. So those couple of hours every week definitely will help you to decide whether you want to partake in a role in the NHS. So I would definitely advise that you try and find some work experience or just be a volunteer.
Live 1,000 lives. We are the NHS. We are recruiting now. Search NHS Careers.
I'm a sixth form student, so I'm in my final year before I decide to go off to university next year. And one of the biggest things for me was flexible hours. So I was able to choose when I wanted to work, how many hours I wanted to work, where I wanted to work. So it was very on a weekly basis. It's just so easy for me to work around my schoolwork and going to school and anything else and being able to put it in my schedule. I'd also say the transferable skills are amazing. So improving my communication skills, because I'm constantly speaking to patients and colleagues. My time management, my organizational, my teamwork skills, everything has improved while working within the NHS. And if anyone decided that maybe working within the NHS wasn't for them, or just in anyone's everyday life, those skills can be used in everything you do. They give the uniforms free. Your two sets of uniforms are free. Your ID card's free. And there's just so many other benefits that you get from working within the NHS. Just getting to work with different people, it's amazing. And I really appreciate the opportunity that I've received. One thing I would say I enjoy the most is just speaking to my patients, especially the elderly. Ones because I normally tend to work within the elderly sector, but I tend to change depending on the week and depending on where I can find. But just being able to talk to them, learn about their past experiences, especially because visiting has been restricted, so they haven't really had that face-to-face interaction, maybe with families or friends. So being able to speak to them and seeing the joy and happiness in their face because they know that they're not forgotten about. Because being in a hospital, everyone is so busy trying to get their work done, and sometimes you may feel that you're being forgotten, so it's just good to talk to them. Like, for example, I had a patient who was a dancer when they were younger, and so they would tell me everything they used to do when they were young, where they used to train, the styles of dance they used to do. And obviously, me being a dancer, it was really interesting to hear that aspect of their life, and we were able to almost connect. And so I feel like it just made them feel better and to make them feel seen and not forgotten in a hospital setting. So it was good. So my plan is to continue my journey with the NHS. So I mentioned that I have sent off my uni application. So I applied for medicine, and I'm hoping to become a medical student, train at different hospitals, hopefully maybe different places in the world, and come back and work with the NHS in the future. That is definitely in my plans.
I am midnight and the morning light. I have moulded amputees into athletes. I am the pupil, the teacher, the leader. Don't just live your life. Live 1,000 lives. We are the NHS. We are recruiting now. Search NHS Careers.
One of the biggest things I just want to say is that if you ever feel that, oh, you're too young, you're inexperienced, it's not true at all, because this was my first job. Being a volunteer was my first kind of independency, because I was only 17 when I started my volunteering, and I did that for 6 to 7 months. And it just gave me some good care experience, and then I used that to become a healthcare assistant. And this has been my first role, my first proper job as being an adult. So never think that you can't do that and that you're too inexperienced, because there is a way. There's always going to be a way to find a good role that's suitable for you within the NHS, because there's just such a wide variety of jobs. And the best place to start, I would say, is NHS Careers. So if you just log on to the website online, it's available to everyone. You can take quizzes and you can look at the different roles available near you and the experience or what they're looking for, and see if that suits you. But I would definitely say start with NHS Careers.